Hello and warm greetings to our listeners. Welcome to Healthy Men 70 Plus, the channel dedicated to helping you live your best life with clarity and confidence. I'm Emily Johnson, your health and wellness coach.
And I'm Robert Miller, your senior men's health specialist. We're really glad you're joining us today for a deep dive into some pretty crucial health insights.
Yes, today we're tackling a topic often shrouded in, well, silence and maybe some misinformation, yet it holds surprising keys to your overall well-being. We're going to unpack some truths that many men, frankly, wish they knew decades ago, secrets that could make a significant difference in your health, mood, and vitality right now.
Exactly. We've been looking at some powerful sources, including insights from Dr. Mohit Khera, who is a urologist and professor of men's health. He spent, over 30 years treating men just like you. And he argues that after 60, certain aspects of self-pleasure aren't just normal. They could actually be the difference between, well, life and decline.
So this deep dive isn't just about pleasure. It's really about preserving function, reclaiming connection, and fighting back against aging where it often starts, in the nervous system. Our mission today is to give you practical science-based insights to help you understand what's really happening in your body and, importantly, how you can take control. So let's unpack this. Let's start with the first and maybe the most overlooked mistake men can make in self-pleasure, what we might call mindless masturbation. It's subtle, it's silent, and it can gradually work against you after 60.
Right. And what's fascinating here is how something that feels, just routine can actually become detrimental. Dr. Khera shares that many older patients confess they don't feel much anymore or maybe can't finish unless I do it a certain specific way. They feel like their body forgot how to feel.
So what's really happening there from a biological perspective?
Well, it isn't just a bad habit. It's actually a neurological conditioning loop. When you rush through the act, maybe with tension, using the same hand, same motion, same outcome, you're inadvertently training your brain. You're training it to associate arousal only with that very specific, often quite intense routine. And your brain, well, it learns fast.
And the consequences of that kind of conditioning.
Over time, sensitivity drops. You might notice erection quality fading, and you might need more and more stimulation, or perhaps more pressure. This can then make it harder to respond to a real partner, which can lead to avoiding intimacy altogether. This conditioning, it can manifest as what some call porn-induced erectile dysfunction, or PID, maybe delayed ejaculation, or even anorgasmia, the inability to climax.
Wow. Sounds like it goes way beyond just the physical sensations.
Absolutely. The damage isn't just physical, it's deeply emotional. Frustration, shame, depression, this feeling that your body is broken. This can lead to a loss of confidence, connection, even withdrawal. And that can be a gateway to emotional distance and maybe even early signs of cognitive decline. But the body isn't actually broken. Dr. Khera says it's more like it's been overtrained in the wrong direction.
Okay, but there's good news here, right? It's not irreversible.
Definitely not. Your body can absolutely relearn, and the nervous system has a remarkable capacity to heal. It just requires, awareness, some patience, and a new approach, slower, more conscious, more connected. Connected not just to sensation, but to emotion, too.
Okay. Now, on the flip side, let's talk about something equally dangerous, maybe even more common, that society sometimes praises.
Yeah.
Not masturbating at all after 60. You might think, okay, that chapter is closed, but could that actually be slowly sabotaging your health?
This is where a story like David's comes in. He was 68, getting up 5-6 times a night to pee, feeling pressure, a dull ache. He just chopped it up to age. When asked about ejaculation, he said it had been years. This is a really common myth, that men should just shut the whole system down after a certain age.
Well, what happens if the system does shut down? The prostate doesn't just stop working, does it?
No, exactly. Your prostate continues to produce fluid. If it's not released regularly, it builds up. It creates this stagnant reservoir that leads to congestion, inflammation, discomfort, and it often manifests as that urinary urgency, a weak stream, dribbling, maybe even pain.
And are there more serious implications than just discomfort or inconvenience?
Yes, unfortunately. Chronic prostate inflammation has been linked to an increased risk of developing prostate cancer. Now, a huge Harvard study followed nearly 30,000 men, and it found those who ejaculated at least 21 times per month had a significantly lower risk of prostate cancer. That's not myth. That's data. It's about clearing the pipes, so to speak.
So it really comes down to active care for an important organ, just like you'd manage blood pressure or heart health.
Precisely. And David's symptoms. They improved once he understood this and gently re-engaged. Neglecting this part of your health can lead to chronic discomfort, unnecessary medication, potential surgery, and yes, a higher risk of cancer. You wouldn't ignore your heart. Don't ignore your prostate.
Okay, now let's connect the dots between that physical aspect and the emotional side. Let's talk about shame around self-touch and how it can damage your mental health. The silence here can be incredibly damaging.
It really can. Many older men carry deep-seated shame, often from messages received way back in life being taught that touching themselves was dirty, sinful, weak.
Mm-hmm.
Those messages, they don't just disappear. They go underground and they shape the relationship with their own body, often leading to this quiet withdrawal, a disconnection from physical touch and desire.
What are the biological consequences when that kind of emotional repression takes hold?
Well, regular healthy sexual touch, and that includes masturbation, actually supports mental well-being. It helps regulate cortisol, your stress hormone. It boosts dopamine, fosters oxytocin, that's your brain's trust and connection hormone. All of this aids sleep, mood, even cognitive function. Shame disrupts all of it. It literally tightens muscles, raises stress hormones, creates these guilt loops.
And chronic stress, we know, is a huge health concern, especially as we get older.
It absolutely is. Chronic stress is linked to anxiety, depression, heart disease, immune dysfunction, even dementia. Dr. Khera talks about a 72-year-old patient, divorced, deeply depressed, hadn't had any sexual activity in over a decade, just believed it was over. Simple exercises to reconnect to his body without guilt led to improved sleep, lower blood pressure, and he said his spark came back.
That's incredible. It's such a reminder that you're never too old to feel alive, to feel connected to yourself.
Shame takes your vitality just inch by slow inch, reclaiming self-touch with kindness, with dignity, with purpose. It's vital for feeling whole.
Okay, another big piece here is testosterone. We often associate declining T levels with just getting older, but what if I told you that your testosterone might drop faster when you stop engaging with your sexual self altogether?
This is a crucial insight, really. Testosterone fuels your energy, your strength, drive, confidence, desire. It's fundamental. It doesn't just fade because of the calendar pages turning. It also drops when you stop, well, living like a man who still wants to feel alive.
Yeah.
When that sexual energy is ignored or suppressed, your body kind of turns down the dial on its own masculinity. It reallocates resources.
And what does that look like in daily life? How would someone notice that?
You might see muscle tone fading, maybe more belly fat creeping on, sleep gets worse, and that spark, that vitality you remember, it starts to vanish. It's not always just because you're old, but because your body isn't getting the signal that you're still here, still alive, still capable of desire.
Like the example of Frank, the 73-year-old retired firefighter you mentioned.
Exactly. Frank felt tired, felt like he was just slowing down. His testosterone was barely above clinical deficiency. He literally said he didn't see the point anymore in sexual activity. When he slowly, carefully re-engaged with himself, his hormone levels actually improved. His posture changed, his voice carried more weight, his eyes lit up again. It was noticeable.
So even solo activity can send a really powerful signal back to the body.
Yes. Intentional solo touch reminds your biology that you're still in the game. Studies actually show short-term boosts in testosterone following sexual stimulation, even solo stimulation. Things like erotic imagination, physical engagement, even just anticipation can affect hormone regulation, mood, motivation.
And the cost of low testosterone isn't just about sex drive, is it? It's much broader.
Much broader. It's linked to fatigue, yes, sexual dysfunction, but also heart disease, diabetes, cognitive decline, depression, and even potentially a shorter lifespan. It's a vital marker of how engaged you are with life. Reclaiming this connection to your body on your own terms without guilt, it's a powerful step back towards that vitality.
Okay, let's talk about erectile function itself. Many men might think, well, if I'm not having sex, I don't need to worry about erections anymore. But this sounds like another quiet lie with a pretty steep cost.
Right. Erectile function is about so much more than just sex. It's really a window into your blood flow, your nerve health, your cardiovascular integrity, and even your longevity. Harold's story is a stark example. He was 69, and he'd gone maybe 5 or 6 years without an erection, by choice, just thinking that part of his life was over.
So what happens physiologically when that system isn't used? When the body assumes it's obsolete?
Well, think of the penis like any other muscle and vascular structure. If you don't use it, the tissues lose elasticity, the blood vessels can stiffen, oxygen flow decreases significantly. Over time, you can get micro tears and fibrosis, which is basically a hardening of the soft tissue. Eventually, it may simply not respond as it once did, not because of age alone, but because of disuse.
That sounds like a pretty significant biological decline setting in.
It is. When regular erections stop, the smooth muscle inside actually atrophies. The blood vessels become less efficient. Nitric oxide, which is crucial for erections, diminishes. And this happens whether you're sexually active with a partner or not. It's just biology. Your body assumes that the system is obsolete if it's not being activated.
And the impact goes beyond just the physical mechanics,
And
right?
absolutely. As the body loses that capacity, confidence often erodes, self-worth can slip, and men just feel less like themselves. This can lead to withdrawal, depression, even those early signs of cognitive slowing we talked about.
So how can men work to preserve this function, even if partnered sex isn't happening?
You have to remind your body it still matters. Regular erections, whether they happen through self-stimulation or even sometimes non-sexual arousal like morning erections, they keep blood flowing, tissues oxygenated, and those crucial neural pathways alive. It's not necessarily about chasing pleasure. It's fundamentally about preserving a core part of your physical health and your identity as a man.
Okay, now for a topic that's often kept in the shadows, especially for older men, pornography. It's sensitive, but understanding its impact seems crucial.
It really is. Many men in their 60s and 70s watch porn, often out of loneliness, maybe boredom, or just a desire to feel something, anything. But today's internet pornography is vastly different from, say, magazines of the past. It's a constant flood of high-speed, high-stimulation, instant gratification content. Very intense.
And how does that specific kind of content affect the aging brain?
Well, repeated exposure desensitizes your brain's dopamine response. Dopamine is that reward chemical, so it becomes harder and harder to feel aroused by natural, real-life touch. Your brain starts needing more intensity, more novelty, just to get the same effect. This isn't psychological weakness, it's neurochemistry at play. Your actual brain wiring gets altered.
What are the physical and emotional costs when that wiring changes?
Physically, erections can become less responsive to normal stimuli. Orgasm might become more difficult to reach. Some men develop that PIE we mentioned, where they find they can only perform with porn. Emotionally, it leads to immense shame, anxiety, frustration. Men start believing they're broken, not realizing the source of the issue might be the very thing they turn to for stimulation.
But you mentioned earlier this isn't necessarily a permanent state. There's hope for resetting.
Absolutely. Your brain, even after 60, retains amazing plasticity. It has the capacity to heal and reset. The healing starts when you consciously step away from those artificial highs and intentionally reconnect with reality, with presence, with actual sensation, with your imagination, even with silence. It's about rebuilding your nervous system's relationship to pleasure on your own authentic terms.
Okay, finally, we arrive at what you suggested might be the most dangerous mistake of all for older men. Isolation. And we're not just talking about living alone, but a deeper silence where you stop being touched, maybe you stop touching yourself, and stop connecting with your own body.
Exactly. Peter's story really brings this home. At 76, a retired engineer, he hadn't been physically touched in over a year. Not a hug, nothing. He spoke about it with resignation, like it was just normal. But touch isn't a luxury, it's a biological need. The human body, at any age, is fundamentally wired for connection through touch.
What happens when that deep biological need isn't met for a long time?
Yeah.
How does the body react?
When we go too long without physical contact, oxytocin levels plummet. Stress hormones like cortisol tend to creep up. Blood pressure can rise, sleep suffers, immune function weakens. And perhaps most dangerously, the brain can begin to shut down emotional and sensory circuits. It's almost like a form of self-protection. We literally start to go numb, not just physically, but emotionally too.
That's a profound loss of aliveness, a real fading.
It is. And this deep isolation often starts quietly, maybe in the bedroom, when a man stops touching himself, even just for self-connection or comfort. His brain interprets this lack of touch as an emotional retreat, and it becomes self-reinforcing. This leads to that slow fading of identity, purpose, and emotional sharpness.
And the ultimate cost is, well, it's immense.
Immense. Isolation is directly linked to higher rates of depression, heart disease, cognitive decline, and even early death. It's not about age. It's about abandonment, often. Abandonment by the self. But surrender doesn't have to be the final word.
So how do we fight back against this quiet, insidious threat? How can men reclaim that connection?
It can start simply. The act of touching yourself, whether it's sexual or just simple, mindful self-touch, is about claiming your body as still yours. It's sending a message. It tells your brain, your heart, your nervous system, I'm still here, I still matter, I still want to feel. Many men have described coming back to life simply by giving themselves permission to reconnect, to break that silence, and return to touch.
Wow, Robert, that was a truly, truly eye-opening deep dive. It's so clear that these aspects of men's health, often ignored, are deeply interconnected with our overall well-being, our vitality.
Yes, and the simple truth is this. You're not broken. You're not past the point. And you're definitely not alone in feeling these things. Every system in your body right now wants to respond to connection. Your brain still wants to feel, your heart still wants to open, and your skin still wants to remember what it means to be alive.
So for our listeners who feel ready, maybe inspired to begin that journey back, what's a practical first step, something tangible they can do?
Dr. Khera talks about something he calls the golden protocol. It's beautifully simple. 10 minutes a day. That's it. Just 10 minutes of quiet, intentional, respectful time to reconnect with yourself. No agenda, no pressure to perform, just touch, breath, and awareness. For many men, this becomes a turning point. Because when a man touches himself with care, not out of habit or desperation, but with genuine curiosity and presence, something fundamental shifts. His body remembers, his mind softens, and that vital spark, it returns.
It's really about reclaiming yourself, isn't it? Not just sexuality, but your whole self. And that journey can start right here, right now, with you.
We really hope this deep dive has given you some valuable insights and maybe some actionable steps for your own health journey.
If this message resonated with you, if it felt important, please take just a moment to like this video, maybe share it with other men who you think might benefit, and subscribe to Healthy Men 70+. Your engagement, it really does help us create more content that truly serves you.
Thank you so much for joining us today on Healthy Men 70+.
Until next time, stay well, stay curious, and please keep connecting with the incredible vitality that lives within you.